The ERS is the biggest congress on respiratory medicine, respiratory disorders in the world. So it's very important to be here and to participate in the exchange between clinicians, between scientists, basic scientists, but also clinical researchers from all over the globe. So we have interaction between our friends, our colleagues. We see the most recent scientific developments. We see new data presented in abstracts, but also in presentations. And this allows for further discussion. And I can translate these findings directly to my patients in my clinic. I would say three keywords are interaction, scientific exchange, and distribution of knowledge. So that means we interact with our friends, with our colleagues, not only within Europe, but also from Asia, from America, from all parts of the world. And this allows to push medicine forward. This means that we have a huge impact on our scientific approaches. My special interest is sleep medicine and respiratory medicine, intensive care medicine, for example. And that means we are focusing on breathing disturbances during sleep. And we are saying that we should not only look for the number of breathing disturbances, so the apnea hypopnea index, but we should see how it translates in hypoxia. That means what is relevant for the patient for cardiovascular outcome, for example. And if we use the hypoxic burden, which is the area under the curve of the oxygen saturation, we see better association with cardiovascular outcomes. We used a new classification system which has been established a few years ago, the Baveno classification, which does not look for the AHI, for the number of breathing disturbances, but it looks for symptoms on the one hand, comorbidities on the other hand, and severity of the disease. And we are trying with this study to add the information by the hypoxic burden. We want to see if hypoxia is really relevant. So our future research priorities will focus on breathing disturbances during sleep and the interaction between non-invasive ventilation and other treatment options for patients with hypoxia, with hypercapnia, and also with sleep apnea. So this includes especially to select the patients, to find those patients who require treatment based on their symptoms, on their comorbidities, and to optimally treat them not only with devices, for example, positive airway pressure devices, but also for drugs. We are facing new approaches to treatment, for example, sleep apnea, in terms of drug treatment. And I'm expecting to have available drugs within the next 5 years.